First Aid in Mental Health, Part 5. First Aid in Anxiety. Feeling anxious in certain situations is normal. However, if your anxiety is not in the proportion to the situations, or if it continues even after the anxiety creating situation has subsided, it's a matter of concern. If unchecked or not treated, such type of anxiety can reach to the extent of anxiety disorder. Some factors contributing to anxiety are as follows. First, genetic factors. Individuals who have family history of anxiety, that is if they have anyone in the family who was or is suffering from anxiety issues, such individuals are at higher risk. Second, brain chemistry, imbalance of certain neurotransmitters. Third, traumatic event like abuse, rape, or sudden death of any of the parent. Fourth, parental divorce. Fifth, stress about college exams. Anxiety can be a matter of concern when it starts affecting and interfering with the functions of daily life of the individual. There are different types of anxiety disorders like social phobia, separation anxiety disorder, acute stress disorder. In general, the symptoms of anxiety are as follows. Physical symptoms: heart palpitations and rapid heart rate, shortness of breath, dizziness or headaches, restlessness, tremors, and shaking. Psychological symptoms: mind racing or going blank, difficulty in concentration, forgetfulness, problems in decision making, irritability, impatience, and anger. Behavioral symptoms: avoiding people and situations, repetitive checking, strong urge to escape the situation. Individuals who are anxious may not want to go to college or work. Second, complain repeatedly of various physiological problems. Third, get irritated while interacting with their friends or family. Fourth, spend lot of time worrying about how they look. Fifth, be extremely quiet in the class or at work and get scared of asking questions to the teachers or colleagues. Sixth, sometimes ask the same questions repeatedly. Seventh, they visibly show the physical symptoms of anxiety like sweating or excessive body movements. Now that we have seen what kind of thought and behaviors of individuals dealing with depression and anxiety exhibit, let us try to see how they can be helped. The action plan for providing first aid we have already discussed in 6.3. Now we will discuss it from the point of view of depression and anxiety. Step 1. If you see your friend showing symptoms that are mentioned above, and if you feel that there might be a chance of the person harming himself, the first thing to do is meeting his or close family members and sensitizing them about the seriousness of the issue. Also, you can approach the mental health professional along with the family members and discuss your concerns. Step 2. You can give your friend a patient hearing and understanding that neither is he she behaving like that purposely or he she is weak. Instead, he she is suffering from a problem and needs a compassionate hearing from someone. Remember, you should neither criticize your friend while listening nor should you make any harsh comments. Step 3. Sometimes the person may experience shame or feel guilty. In such a situation, you can help the person by giving hope and making them realize that A. Many people are diagnosed with mental disorder. B. Having a mental illness is not their fault. C. One may take some time to get better with the help of a proper mental health professional, but it is certainly curable. Step 4. As mentioned in Step 3, depression and anxiety are curable with proper scientific treatment given by a mental health professional. You can support, encourage, and even accompany your friend to see a counselor or psychotherapist. Getting the person proper professional help in mental health care is the key to dealing with mental health issues. Step 5. You can help the person identify some of the positive behaviors which can help them to cope with their mental health issues. They can engage in the activities which they like or which they always wanted to pursue. Performing self help strategies can also help them regain control over their life. Encourage them to use simple relaxation techniques as follows: using laughter, deep breathing techniques, exercises like walking or running or playing any outdoor games, etc. In the case of anxiety and depression, seeking professional help is very crucial. So, encouraging a person to reach out to a professional for help is the most important. Activity 3. Try this. Breathing. This is an activity that you can do when you are upset by something. You can try doing this breathing exercise to relax before reacting to the situations. Steps: exhale completely through your mouth. Close your mouth and inhale through your nose for 4 counts. Hold your breath for 7 counts. Exhale completely through your mouth for 8 counts. This is one cycle. You can repeat this cycle more times. With practice, this will get easier. Certain behavioral issues. You may have heard of people becoming addicted to substances like alcohol, drugs, or cigarettes. But did you know that the same can happen with certain activities? Sometimes people feel the need to engage in an activity or behavior, even though it has a negative impact on their mental and physical health. It can also have an impact on their ability to function at home, school, college, or at work. Such behaviors are called behavioral addictions. Some examples are shopping addiction, internet addiction, excessive social media usage, exercise addiction, gambling addiction, etc.